Thanks, Steve. Mary, you're right. It's difficult, it's messy, but it's worth doing. Okay, get in the Wayback Machine and go all the way back to 2004. Our health system's kind of broken. We have problems with quality, we've got problems with access, we've got problems with cost, and you're on the board of A.T. Still University, and I've actually written down the punchline of the mission statement. Focus on whole person healthcare, scholarship, community health, interprofessional education, diversity, and underserved populations. And you've got a medical school and School of Health Sciences, School of Health Management, School of Dentistry and Oral Health. Since that time, we've tacked on the new medical school, School of Osteopathic Medicine in Arizona, and the Missouri School of Dentistry and Oral Health. And what's unique about this stuff is that you're partnered with the National Association of Community Health Centers. And NAC, as you know, is the safety net organization with 1,300 wonderful corporations around the country that provide 20 million people with 80 million healthcare interactions every year, and it's going to go up to about 130 million healthcare interactions. And guess what? We don't have the providers to make that happen. So you got to start doing something in 2004, planning something that's going to make a difference as we move forward. And it's got to be something that's scalable and can be replicated by others so that you can actually make a difference being one little, 6,000 professional student kind of an institution. So you get a blue ribbon panel together and you say, what are we going to do? I know. Let's put our medical students for 3 of their 4 years of medical education out at community health centers, these wonderful organizations. Maybe it'll change the way in which they interact with the community and the professional choices that they make. And then let's try and get residency programs in there as well. Get a blue ribbon panel together, throw the idea up. What do you come up with? Well, 2007, you open a medical school, and the students know when they get there, they're going to be in Mesa, Arizona for 1 year. And at the end of that 1 year, they're going to go to one of 11 pre-assigned institutions that are community health centers. And each community health center is going to throw its arms around that class of 10 students for year 2, year 3, and year 4. The students become part of the community health center, and they function as members of the team from the minute that they get there in their second year. They still get their student education in the basic sciences, asynchronously and synchronously, some live. About 2008, we had this economic crisis, and the government couldn't get rid of the money fast enough for a while, and we got this TARP money. We got this wonderful video telecommunication stuff that's helped us a lot in terms of the way the students can meet with each other, meet in teams on different campuses and so on. So live is possible. Epidemiology and biostatistics is taught live, and yet they have the ability to do the asynchronous thing, slow it down, speed it up. They spend 1 day a week in campus clinic at the community health center in that community. And in addition to that, every single student as part of epidemiology and biostatistics does a community project, social determinants of health, need in the community that needs to be addressed by that student team. Some of them have been going on for years. Y&I out in Hawaii, they call it mini doc. They go to the homeless people on the beach and others in the community with their little red shirt on. They're third graders. They've been taught how to teach prevention, and they teach prevention, and we've seen measurable change in the community from those kids doing the teaching. No, Mom, you shouldn't smoke anymore. And things do change. We've got measurements for it. Every one of them puts up a poster for NAC, the National Association of Community Health Centers. They've won awards. They've beat out us and the PhDs and everybody else and won awards at those centers. So year 3 and year 4, the curriculum is a little bit more ambulatory than what you're used to, but the curriculum is focused in the community. They go to the same hospitals in the community that their patients go to. As much as possible, they go with the attendings who are members of the staff at the community health center. And so what have our outcomes been? Well, NAC has some specialties that they need, along with the obvious ones in primary care, the usual disciplines. The other specialties they need are general surgery, geriatrics, and psychiatry. 80% of our graduates have chosen careers in primary care and NAC-needed specialties all around the country. 80% at this point. Now, to be candid, this is not yet the true end of the story, because our first class graduated in 2011. All I can tell you is that the residencies are indicative of the right choices. The next step will be, how do they get hired? Where do they go? I can tell you in Ohio, our teaching health center residents and one of our medical students just graduating this year have all signed contracts with our campus health center to become faculty at that campus health center. 3,000 volunteers, most of them NAC employed around the country on our faculty, and at every single site we have paid faculty who are learning facilitators, do the small group, and work with the students and provide the students with a mentoring experience and actually get to come to Arizona for graduation and put the hood on that student after the 4 years of medical school. So our regional directors of medical education are fantastic. Every time somebody comes around to accredit us, they say, how did you get such wonderful faculty at your community health center? It was really easy. We went to the health center and said, are your best teachers interested in doing this? Every health center knows who their best teachers are. They gave us those people, and as long as we don't ruin them, they are great teachers for our students. Thank you.